Hi there, my name is Kristen Schmidt, and for my advanced physical assessment technique, I chose egophony. What is egophony? Egophony is a physical assessment technique that is used while auscultating a patient's breath sounds. It helps to determine if there is lung consolidation within the patient. Lung consolidation can be pleural effusions or pneumonia-related infectious processes. This occurs where fluid replaces the air within the lungs. The physical assessment technique allows the healthcare professional to determine if there is a need for further testing based off of what is being auscultated. In order to assess for egophony, you will need to have a quiet room. You will also need to auscultate each lung sound with direct skin contact with your stethoscope. Then, auscultate the lung sounds of the patient. While auscultating each lung sound, have the patient say E. Although you want to auscultate both anteriorly and posteriorly, if the healthcare professional is concerned about consolidation, then it is likely to be heard posteriorly because of the air movement through the trachea and large airways. Anterior breath sounds may be deceiving, as you may hear heart sounds and also may have anatomy interfere with the lung sounds that you're listening to, so they're not as clear. Examples of this could be women's breasts or an obese individual that makes it difficult to hear. While auscultating the patient's lungs, have the patient say E. While listening, if the E sounds more like an A, then the healthcare professional should be concerned for consolidation. Here's a video demonstrating how to auscultate and assess for egophony.
You do it in the front and the back, but for the video's sake, we're just going to do the back. So each time I listen to your lungs, I need you to say E and hold it, and I'll tell you when to stop. Okay? Typically, in a patient's room, you would want to listen to the bare back, but for the video's sake, we'll listen with the shirt on. Ready?
This video demonstrates how one would auscultate the lungs of a patient. For this video and privacy of the patient in the video, direct skin contact was not made with the stethoscope. However, with a patient, you would need to auscultate underneath the hospital gown to make direct skin contact. The science behind egophony. If there is a consolidated area of the lung, this consolidation does not allow certain frequencies to pass through. If you hear E with each lung sound, the healthcare professional does not need to be as concerned about consolidation. However, if A is heard, there is a concern for consolidation. E has a lower frequency than A and is unable to be conducted through the consolidation. And I just have a picture here that shows just the general idea of consolidation. It's obviously not a chest x-ray, but it kind of gives you the basic needs, or gives you the basic info about, this is a normal lung over here, and then this area, the black area down here, is consolidated. After assessing the patient, review with them their symptoms. Unfortunately, there is no tell-all symptom that will demonstrate egophony. The patient's symptoms may be very vague, so further testing will likely need to be done. Tests such as blood work, CAT scans, and chest x-rays may need to be done to further investigate the patient's symptoms. It is also important to review the patient's history to assess whether they have a history of COPD, restrictive lung diseases, or asthma. Although egophony can be very helpful in determining which treatment route to go, many further assessments and tests need to be done, so it's not the only thing that we should rely on within the patient. And those are my references.